Speaking of sports, we're going to talk sports medicine right now with our good friend Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center. And Joe, you want to go to the hand today and talk about finger injuries.
Yeah, but really where I want to go today, Ray, is I want to go on a sunny day like today. Is there any way you and I could sneak out and get some tickets for that game? I love daytime baseball, too. Could you and I just sneak out and don't tell anybody? And we could.
I would love that, my friend. Love that.
I would love to share some baseball knowledge with you, too, because I know you know the game so well. But, this week there's been a couple of finger injuries, and I think there's sometimes the perception in sports medicine that finger injuries, finger fractures are not a big deal, and you can tape them up and you can do anything with them and splint them up and people play. And I think just the way you see it happen, even in professional athletes, again, we look at that and we see that, hey, maybe it's not such it can be a little bit of a problem as you see a superstar like Zion Williamson broke the ring finger on his hand. His coach ends up getting fined saying he's just getting mauled every time he goes to the basket. And this was inevitable. It was going to happen. But he had a bad ring finger injury. Looks like it's going to be surgery. Looks like he may not get back at all this year. One of the real bright young stars in the game with a ring finger injury. In Cleveland and baseball, as we were talking earlier, our catcher, Roberto Perez, he does such a great job handling our great pitching staff. And Roberto, a couple of weeks ago, you may remember, Ray, this goes all the way back to April. He had a ring finger injury, a fracture, and he tried to play for almost 2 weeks. I don't know if you remember that. And as we watched him play, he was having trouble gripping the bat. He was having trouble catching. And ultimately, he went back to the hand surgeon, had surgery done. We're not going to see Roberto till probably the All-Star game or maybe after the All-Star game, after the surgery on his finger. So maybe these things aren't such no big deal at all. They can be a problem. And they do have differences in kids. So I really, because I'm in a pediatric sports medicine setting, I want to explain just a little bit about what are some of the differences. In anybody, the finger has multiple joints. It's not just one joint. As you know, there's a joint near the tip and in the middle and on the knuckle. And in each one of these joints, there are ligaments, tendons, bones, and of course what you've heard me say so many times in our younger athletes, what makes them different are growth plates, places where the bones are growing. And so kids are a lot more prone to different types of fractures. They can have fractures that really get complicated with a twisted injury or an angled injury, or sometimes even injuries where they can't use the hand afterwards, and that's not a good complication for a kid with an injury. So I just want to tell people, have a high index of suspicion when it's a finger injury. And it's just one of those things as a parent, you kind of have to bite the bullet. If there's any concern, we have to get an x-ray and have that evaluated. You don't want to ride out a finger injury because it does have some complications to it. Typically, I was talking to one of my surgeons last night in preparing for this, and it doesn't always have to be the first day. If it doesn't look like an obvious fracture, maybe we could wait a day or even two. But if you wait much more than 2 or 3 days, it can start to heal in a way that can be a complication. So things you'd be looking for: swollen in the joint, bruising. If you're starting to see where it's twisted at all or angled at all or rotated at all, that needs an x-ray. Let's get over and get that thing x-rayed to help a kid. Number two is if it's crushed at all on the end of the finger or the fingertip or blood in the fingertip, that needs to be looked at, and that needs to have an x-ray done. That's just all there is to it. We need to get it done and get an x-ray done. If kids dislocate their finger, we talked about this before, they either tore a ligament or they have a bony fracture. And again, because kids' bony fractures sometimes don't heal all that well, with a significant dislocation in the finger, they ultimately are going to need getting an x-ray done. So instead of sitting on it and waiting for the chance of a complication, the complications are they get deformities. Kids can get deformities. Kids can get weakness. Kids can get issues where they can't bend or use the hand and the finger, and that's really a big deal. And my surgical friends sometimes have to do what's called a revision surgery 2 months later, where they go in, kind of re-break it, try to reshape it, and that's not always works out that well. So understand that while we're watching our superstars like Zion Williamson and Roberto Perez, and those are big deals with surgery, you also have to have a high index of suspicion for different reasons with kids. And if there's any doubt, you just have to get them in. We have to get the X-ray, and we have to know what's going on. Although it seems like little joints and little problems, that's not the case at all. These can really lead to some really big and major complications.
Yeah, it's much bigger, Joe, isn't it, than just at that moment. With these kids, you're looking on down the line, whether it's being in the athletic arena or what they might be able to do with their lives on the professional side if they have problems with those fingers.
No doubt about it. It can affect everything they do ongoingly. So you got to kind of fight the urge. And you know that you and I were parents too, and there's so many crazy things going on at home, and you take a look at a finger and, oh, come on, can't we just tape it up and ride it out or something like that? But keep a close eye on it. And if it's bruising or twisting or angling or anything like that, swelling a lot, and they can't bend it at all after a couple of days, let's get them in and get an X-ray, and let's treat our kids correctly in the sports medicine realm and make sure that we're not leading these kids down the pathway of a more permanent disability in their hand.
Terrific stuff this morning, Joe. Thank you very much, my friend, and I'll talk to you again next week.
I'll meet you at the ballpark at 1 o'clock, okay?
That sounds good. Have the nachos ready, my friend.
Oh, thank you. All right. Have a good week.
You too. Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center.